Welcome to the Health Conditions YouTube channel. Today we are discussing autoimmune disorders. Autoimmune disorders are a group of illnesses in which the body's immune system attacks its own healthy tissues, cells and organs. This leads to inflammation and damage to various parts of the body. Some examples of autoimmune disorders are rheumatoid arthritis, lupus, type 1 diabetes, multiple sclerosis, and celiac disease. In autoimmune disorders, the immune system mistakenly identifies normal body parts as foreign substances and launches an attack against them. This leads to chronic inflammation and tissue damage, which can cause a wide range of symptoms, including pain, fatigue, and organ dysfunction. The exact cause of autoimmune disorders is not fully understood, but it is believed to be a combination of genetic, environmental, and lifestyle factors. Treatment options for autoimmune disorders vary depending on the specific condition and may include medications, lifestyle changes, and immune-modulating therapies. Autoimmune disorders can range from mild to severe in terms of their impact on a person's health and quality of life. While some autoimmune disorders may cause only minor symptoms that can be managed with medication and lifestyle changes, others can be life-threatening and require ongoing treatment and monitoring. For example, in autoimmune disorders like type 1 diabetes, if left untreated, the body's inability to produce insulin can lead to serious health complications, including diabetic ketoacidosis, nerve damage, and heart disease. Other autoimmune disorders, such as lupus, can affect multiple organs and systems in the body and lead to serious, long-term health problems. In general, it's important to seek prompt medical attention if you suspect you may have an autoimmune disorder, as early diagnosis and treatment can often help prevent or minimize the development of serious complications. Here are some of the most common autoimmune disorders. Rheumatoid arthritis, RA, a chronic autoimmune disorder that affects the joints and surrounding tissues. RA causes inflammation in the joints, leading to pain, swelling, and stiffness. Over time, the inflammation can cause damage to the cartilage, bones, and other tissues in the joint. Systemic lupus erythematosus, SLE, a complex autoimmune disorder that affects various parts of the body, including the skin, joints, kidneys, heart, and brain. SLE can cause a wide range of symptoms, including fatigue, joint pain, skin rashes, and fever. Type 1 diabetes, a chronic autoimmune disorder in which the body's immune system attacks and destroys the insulin-producing cells of the pancreas. This leads to an inability to produce insulin, which is necessary for regulating blood sugar levels. People with type 1 diabetes must take insulin injections or use an insulin pump to regulate their blood sugar levels. Multiple sclerosis, MS, a chronic autoimmune disorder that affects the central nervous system, causing a wide range of symptoms including muscle weakness, problems with vision and coordination, and cognitive impairment. MS occurs when the body's immune system attacks the protective covering, myelin, around nerve fibers, causing inflammation and damage. Hashimoto's thyroiditis, an autoimmune disorder that affects the thyroid gland, leading to an underactive thyroid and hypothyroidism. Hashimoto's thyroiditis is characterized by inflammation of the thyroid gland, which can lead to decreased production of thyroid hormones. Celiac disease, a digestive autoimmune disorder caused by an adverse reaction to gluten, a protein found in wheat, barley, and rye. Celiac disease can cause a wide range of digestive symptoms, including bloating, diarrhea, and abdominal pain, as well as more systemic symptoms such as fatigue and anemia. Psoriasis is a skin disorder that causes red, scaly patches to develop on the skin. The exact cause of psoriasis is unknown, but it is thought to be an autoimmune disorder in which the body's immune system attacks healthy skin cells. Psoriasis can be treated with topical creams, light therapy, and oral medications, among other treatments. Inflammatory bowel disease, IBD. IBD is a group of autoimmune disorders that cause inflammation in the digestive tract, including Crohn's disease and ulcerative colitis. IBD can cause a range of symptoms including abdominal pain, diarrhea, and weight loss. Treatment for IBD typically involves a combination of medications to reduce inflammation and manage symptoms, as well as dietary changes. Graves' disease. Graves' disease is an autoimmune disorder that affects the thyroid gland, causing an overactive thyroid, hyperthyroidism. Symptoms of Graves' disease can include weight loss, increased appetite, and rapid heartbeat. Treatment options for Graves' disease include medication to control thyroid hormone production, surgery to remove the thyroid gland, or radioactive iodine treatment to shrink the gland. Addison's disease. Addison's disease is an autoimmune disorder that affects the adrenal glands, leading to a decreased production of hormones necessary for regulating stress and metabolism. Symptoms of Addison's disease can include fatigue, weakness, and weight loss. Treatment for Addison's disease typically involves hormone replacement therapy to replace the hormones not being produced by the adrenal glands. Sjogren's syndrome. Sjogren's syndrome is an autoimmune disorder that affects the glands responsible for producing tears and saliva, leading to dry eyes and mouth. Sjogren's syndrome can also cause joint pain and fatigue. Treatment options for Sjogren's syndrome can include medications to increase tear and saliva production, as well as anti-inflammatory medications to manage symptoms. Guillain-Barré syndrome. Guillain-Barré syndrome is a rare autoimmune disorder that affects the peripheral nervous system, causing muscle weakness and, in severe cases, paralysis. Guillain-Barré syndrome is typically treated with immunoglobulin therapy or plasmapheresis to remove harmful antibodies from the blood. Myasthenia gravis. Myasthenia gravis is an autoimmune disorder that affects the transmission of nerve impulses to the muscles, causing muscle weakness and fatigue. Symptoms of myasthenia gravis can range from mild to severe and can affect different muscle groups. Treatment options for myasthenia gravis can include medications to improve nerve impulse transmission, as well as immunosuppressive drugs to reduce the immune system's attack on the nerve-muscle junction. Antiphospholipid syndrome. Antiphospholipid syndrome is an autoimmune disorder that causes the formation of blood clots, leading to a higher risk of stroke and deep vein thrombosis. Antiphospholipid syndrome can also cause recurrent pregnancy loss. Treatment for antiphospholipid syndrome typically involves anticoagulant medications to prevent blood clots. It's important to keep in mind that the symptoms and severity of these disorders can vary greatly from person to person, and it's important to work with a healthcare provider to determine the best course of action if you suspect you have an autoimmune disorder. Unfortunately, there is currently no cure for most autoimmune disorders. The goal of treatment for autoimmune disorders is typically to manage symptoms, reduce inflammation, and prevent or minimize damage to the affected tissues and organs. While some autoimmune disorders, such as celiac disease, can be managed through changes in diet, many others require ongoing medical treatment and management. For example, medications such as non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and disease-modifying anti-rheumatic drugs, DMARDs, may be used to manage the symptoms of rheumatoid arthritis. In some cases, certain autoimmune disorders may go into remission, meaning that symptoms may disappear or become less severe for a period of time, but they are typically not considered curable. It's important to work closely with a healthcare provider to determine the best course of treatment for your specific autoimmune disorder and to monitor your condition over time. If you suspect you may have an autoimmune disorder, here are some steps you can take. Schedule an appointment with your doctor. Your doctor can help determine the cause of your symptoms and provide a diagnosis. Keep a record of your symptoms. Write down when they started, how often they occur, and what makes them better or worse. Bring a list of any medications you are taking. This can help your doctor determine if any medications may be contributing to your symptoms. Prepare questions for your doctor. Ask about any tests that need to be done, what the next steps in the diagnostic process are, and what treatment options are available. Be open and honest about your health history. This can help your doctor make a more accurate diagnosis. Follow your doctor's recommendations. This may include undergoing tests, making lifestyle changes, or starting a medication regimen. It's important to remember that getting an accurate diagnosis may take time, and it may require multiple appointments with your doctor and specialists. Don't hesitate to seek a second opinion if you feel that your symptoms are not being properly addressed. Thanks for watching. Don't forget to like and subscribe for more informative videos like this one.